Cervical vertebrae. Cervical vertebrae are the first 7 vertebrae in the vertebral column. When compared to the other types of vertebrae, cervical vertebrae, the smallest vertebrae, body is smaller. Transverse process of a cervical vertebrae have a foramen on each side to provide the passage for the vertebral artery. Spinous process of most of these vertebrae is bifid. Atlas. Atlas is the first cervical vertebrae, which is the bone on which the skull rests. Atlas is a ring-shaped vertebrae. No distinct body or spinous process. Atlas has 2 short transverse processes. It contains 2 flattened facets, which articulate with the occipital bone of the skull as a condylite joint, permitting the nodding movement. The vertebral foramen is relatively larger to provide the passage of the larger upper part of the spinal cord. Axis. Axis is the second cervical vertebrae. It has a small body with a superior projection called odontoid process, which articulates with the atlas vertebrae above. Head pivots turn on side to side on this joint. Thoracic vertebra. 12 thoracic vertebrae are larger than the cervical vertebrae. This region of the vertebral column has to support more body weight. Body and transverse process of thoracic vertebra have facet for articulation with the ribs. Lumbar vertebrae. 5 lumbar vertebrae. The largest of the vertebrae because they have to support the weight of the upper body. Size of the body of the lumbar vertebrae is the largest. For attachment of the muscles of lower back, lumbar vertebrae have relatively large spinal process. Sacrum. Triangular shaped large bone consisting of 5 fused rudimentary vertebrae. It has concave anterior surface. Upper part articulates with the lumbar vertebrae. On each side, sacrum articulates with the pelvic girdle. Inferior tip of the sacrum articulates with the coccyx. Series of vertebral foramen are present on each side for passage of nerve. Coccyx. Coccyx consists of fused four terminal vertebrae to form a small triangular bone. Broad base of the coccyx articulates with the tip of the sacrum.